This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Prepixa 2.5 tablet is a medication used to manage blood clots. It is vital for patients recovering from surgeries or those with specific heart conditions. Indications and uses. This medication is utilized to manage blood clots that develop in the veins of the legs, particularly in patients who have undergone hip or knee replacement surgeries. Additionally, it is effective in managing blood clots in patients with atrial fibrillation, a condition marked by an irregular heartbeat. The drug also aids in the treatment and prevention of blood clots in the lungs and legs, thus reducing the risk of recurrence. How it works. This medication functions by inhibiting factor XA, a crucial component of the blood clotting process, thereby preventing the formation of blood clots. Directions for use. Take the medication as directed by your physician. It is important to swallow the tablet with a full glass of water. If swallowing poses a challenge, consult your doctor for alternative methods of administration. Your physician will determine the appropriate dosage and duration based on your age, weight, and medical condition. Possible side effects. Common side effects include bleeding from various areas such as the eyes, nose, and gums, as well as bruising, anemia, and low blood pressure, which may result in faintness or an increased heart rate. Precautions and warnings. Before using this medication, it is crucial to inform your healthcare provider of any pre-existing conditions, especially liver, heart, or kidney issues. Additionally, pregnant or breastfeeding individuals should seek medical advice before use, as the effects on pregnancy and breastfeeding are not well understood. FAQs. 1. Is this a blood thinner? Yes, it is an anticoagulant that helps manage blood clot formation. 2. What precautions should I take? Inform your doctor about any existing liver, heart, or kidney issues. 3. What should I do if I forget a dose? Take it as soon as you remember, then continue as normal. 4. Can it cause low blood pressure? Yes, this is a recognized side effect. 5. Is it safe during pregnancy? No, it is not recommended during pregnancy. Thank you for watching. If you have any questions or suggestions, please leave a comment below.